I just want you to see this on page 2. It points out our 2 locations, the red dots, one in 74104, our Kendall Whittier area, and the other in the dark purple, our East Side Clinic at 169 and 21st Street, and that's what we'll be talking about tonight. Next slide, please. Just a brief history. The point here is that we are a very young organization. We secured an FQHC status in 2006 and immediately opened our East Side location. Next slide. Our mission basically as an FQHC is to provide primary health care to the uninsured and the underinsured. We are not a free clinic. We provide our services on a sliding fee scale because all the studies show that when a patient has some skin in the game, they are more compliant and their health outcomes are improved. We currently have 68 employees, and we're very proud of the fact that only 13% of them are administrative. All the rest are serving patients. And it's important to note that all of our nursing, clinical support staff, receptionists, referral coordinators are bilingual. Next slide. Last year, we served 10,000 unique patients at our 2 locations. 70% of those patients requested to be served in their first language, even though they are mostly bilingual. This year, we anticipate that we will serve 13,000, 30% growth, patients. 65% of those will be seen at our East Side 21st Street location, and 70% of them live below the federal poverty level, which for a family of 4 is $24,000 in annual compensation. The next slide, I just want to point out the green areas, light and dark, are the only zip codes in the city of Tulsa that had population growth between the last 2 census. And the next slide is an overlay showing the growth of our patients at the East Side Clinic, which lines up with those same zip codes right along the 169 corridor. While we have continued to have tremendous growth because of the demand in the areas, we continue to demonstrate very high healthcare outcomes. And you'll see here we are above the state and national averages in our patient outcomes. And we have been honored by the Oklahoma Primary Care Association as well as the ONE Awards. Next slide. Unfortunately, our current East Side location does not meet our current population, let alone the anticipated growth in that area. We lease that space on a triple net lease at about $6,700 a month, but the real sad tale is because it's a triple net lease, over the past 4 years we've had to invest almost $100,000 in repairs and maintenance at the building. The next slide shows you the difficulties that we've had to overcome, and you have in your appendix at the end of your deck a series of other issues that we have yet to be able to overcome at that particular location. So our proposal is that in order to meet our growing population and in order to be masters of our own destiny and really serve the patients that we have, we need to own our own building. We need to relocate out of our current site, but stay right there in the same zip code so that we can serve our patients and they are not left out without any coverage. So a larger facility is what we're looking for. A larger facility will allow us to provide services that we don't currently provide at our 21st Street location. And those include twice as many exam rooms, which we need, behavioral health offices, x-ray, mammography, optometry, dental, an in-house pharmacy, and transportation services for those patients who are unable to find their way back and forth to the clinic itself. We have selected a site at 11534 East 25th Street, that's Garnett and 25th, nestled right in McCullough Park between the Martin Regional Library, the Disney School, the East Side Early Childhood Development that CAP has, and we believe that this site is completely surrounded by neighborhoods where people could walk to our services.
1 minute.
This is a potential rendering that the architects have done from 2 different angles, as well as a floor plan. The cost for this facility is $10,500,000. We have a breakdown there that includes a 10% contingency as well as a probable stoplight at Garnett and 25th. We believe this will be sustainable because we will reduce operating expenses from rent and repairs. The larger facility will give us increased patients, which gives us increased federal funding. The expanded services will also give us increased federal funding, and the in-house pharmacy will in itself be a revenue stream. The vision priority number 1, revenue sales tax. A healthy community is a community that is productive and is continuing to grow. Many of our patients operate their own business or work for small businesses. You'll see on the next slide we had a study done. Last year the impact that we had on the community was $22 million as set out in the bottom. And in your second appendix at the end of your deck you'll see the back calculations for those particular numbers. Priority number 2, connectivity. We will have in this project 2 ADA compliant vans. We will be on 2 bus routes. There are 3 neighborhoods within walking distances, and we will be nestled in, as I said, many other city investments that are already there. Priority number 3, health, education, and safety is what we do. We will continue to reverse the chronically poor public health statistics that we suffer from by responding to the need of over 100,000 uninsured individuals in the Tulsa area, and thereby improving the safety and security for all of us and improving the overall quality of life. This project will serve the needs of the area, we believe, for the next 10 years. And over that time frame, we anticipate that we will continue to improve the overall health outcomes of all of the patients that we serve. That's it.